I come before you in a time when we are navigating uncharted waters and facing uncertain times. But while things may be difficult, we have prevailed through many hard times before. This is certainly not our first rodeo. In 1900, Whiskey Row was consumed by fire and successfully rebuilt. Back in 1918, the Spanish flu claimed half the population, but we survived. In 2008, one of the greatest recessions in history put a tremendous stress on our economy, but it didn't break us. And in 2013, our community suffered the loss of 19 firefighters, and yet we came together to cope and heal. Our struggles and difficult times have made us stronger, and we've faced them all together. Now, as we face COVID-19, I am certain that we will survive and we will become stronger. History is on our side, and our city and county are resilient. We are surrounded by innovative people who work together during difficult times, and I'm so proud of all the leaders with me here today who are working to ensure that our citizens are kept safe and healthy during this pandemic. I'm also very proud of our citizens. The members of this community continue to join together, helping one another. I've been told about neighbors helping neighbors, families bringing groceries home for elderly folks who need a helping hand, teachers providing child care to working parents whose children are out of school. These are only a few of the stories of citizens being there for one another, and they are the things that make Prescott and Yavapai County great. The kinds of things we need to be doing to get each other through these times. At this time, I'd like to invite representatives from our healthcare organizations to provide an update about where we are today and what measures are being taken to protect our citizens. We'll start with Leslie Horton, the Director of Yavapai County Community Health Services. Leslie?
Thank you, Mayor. And thank you, everyone, for joining us today. My heart goes out to our communities as we brace ourselves for an unprecedented pandemic that we have watched affect so many countries across the globe and now our own. I want to make sure that you all understand at this point in time, we still stand at 0 cases confirmed in Yavapai County. However, I have to preface that with the idea that we have had limited testing, and we're trying to expand that at this time, and we'll talk a little bit more about that. But at this point in time, those people that have proven to be high risk, we have been able to test, and those tests have all come back negative at this point in time. And so right now, as we stand, there's 20 cases of COVID-19 across the state of Arizona. The total includes 9 in Maricopa County, 4 in Pima County, 5 in Pinal, 1 in Graham, and 1 in Navajo. So there's a lot of things that we can do. And as I speak in many venues this past week, I can see that anxieties are high. We've never faced something like this before. And it is something that we all need to gather support around and help our most fragile in our population. So those more at risk for COVID-19 include our most elderly populations. The youngsters, the middle-aged folks, they're not going to be as heavily impacted by this virus. But when we think about those that are high risk, people over the age of 60 tend to be at a little higher risk than others. But then once we reach up to the age of 70, 75, 80, those folks, especially if they have a co-occurring disorder or anything else that puts their lungs at a compromised state, those people are very impacted by this illness. And those are the ones that we really need to strive to protect. So during this time, I have some recommendations as your health officer, and I want to make sure that everyone understands the importance of washing their hands. And once in a while, I have to laugh to myself that we're going back to basics. These are things that we learned as children that we should know, but this is a great reminder. And here, before we have any positive confirmed cases in Yavapai County, is a great time to practice safe behaviors like better hygiene, washing our hands. If that's not available, please get hand sanitizer, make hand sanitizer, and use it. I like how the City Hall has put out hand sanitizer in their hallways and at their doors, and I noticed that our healthcare providers have done the same. And so if you're sick, please stay home. Even if it's a mild illness at this point, we want people to protect others. It's not about you and how you feel. This is about those people that you could make very sick. So, also, if your children are sick, stay home with them. The president is passing down some new opportunities for us to make up for sick time and other rules that will help us in this. But please, for the rest of our populations, stay home if you're sick or if your family is. If you're an older American, please protect yourself as much as possible. The state health department is asking that you stay home and as much as possible, and allow people around you to help you by means of getting groceries and helping with other necessary trips into town. And then if you're a person, especially with an underlying condition, please be extra careful. Let people around you know that you need their protection. And so if you can think of your community and protecting them, this is all practice. I'm asking you to practice these behaviors so that when COVID-19 reaches our area, we will be practicing these behaviors that will help stop and slow the spread of the virus. So thank you very much. Oh, one more thing. We have some numbers and resources. If you hear rumors that there is a positive case in Yavapai County, we ask that you go to www.yavapai.us/CHS. We will post that information immediately if there's a positive case. There's also a new hotline for questions and answers, which is 1-844-542-8201. If you have questions, please call them, and hopefully you'll get the answers that you are looking for in a quick turnaround. Thank you so much.
Thank you, Leslie. Appreciate your leadership during this time. I'd like to welcome John Amos, CEO of Yavapai Regional Medical Center, and his staff, Dr. Anthony Torres, who's the Chief Medical Officer, and Diane Drexler, who's the Chief Nursing Officer. John?
Thank you. Good afternoon. Mayor Mangarelli, I want to express my appreciation for helping coordinate this messaging this afternoon. It's very important for our community, and I have to tell you, I've been proud of our community in the past, but in the last few days, it just reaffirmed my commitment and my awe and my appreciation for our community partners and everyone that we serve at the medical center. And we were able to have a very successful meeting yesterday morning with quite a few real important agencies related to the health care and the service delivery and the first responders, all those folks that do take care of you, our friends, our families, and our neighbors. And we have some very good, strong plans in place. And kind of to back up a little bit from the hospital perspective, to give you a sense of what we do in these type of situations, is we have very prepared processes that we term as Operation Mercy. And there's different levels where we have situations where we have to bring in extra staff members, or we have to engage additional physician support. And we go through these and we do different drills. We'll do them on the state level. We'll participate on a county level, and then we'll do our own internal processes. And what we essentially do with that, folks, is that we assemble our resources and we reorganize to meet the need. And that could be expanding our capacity for med-surg beds. It could be, well, we need more ventilators. We need more access for protective equipment. We need to work with our group purchasing organization to ensure and increase some supplies that we may be coming into thresholds on. So we have a lot of processes where we reorganize resources in order to meet the need. And that's essentially what you'll see with the medical center. And we'll have triage processes that we practice that we would put into place. That triage process may be community-based, it may be ER-based, or it may actually be internal, where we're supporting the surgical services in a different way for capacities in pre-op or post-op care. We have over 2,000 healthcare members that we work with on a daily basis. We're running routine meetings. We just had a 2-hour meeting this afternoon with leadership. Dr. Torres met with the medical officers from around the state with Governor Ducey this afternoon. Appreciate you making it back up the hill to be with us. And what we're doing in those meetings is we're collaborating with our partners. And these are the large metropolitan hospital systems. They're the community partners that we have. We're coming together to talk about how we're going to employ resources in order to meet the needs that develop. I personally, I'm involved with the Arizona Hospital Association, and through that association, I have the ability to network with other CEOs and other health system leadership in order to talk about processes on how we might set up a particular triage situation for the ER, how we're managing some of our staffing challenges, or maybe it's with the quarantine interpretation of the CDC, as well as the state recommendations with the Arizona Department of Health Services. So we're coordinating those efforts. I'm pleased to say that the folks on a state level and a local level are doing a wonderful job in preparing. And I'll turn it over to my colleagues to share a few comments with you as well.
So John talked, at a higher level, and just a couple of things that we're doing, at the local level, and as indicated by others, this is unprecedented time. So it's changing quickly. So some of the things that we've implemented at Yavapai Regional Medical Center is we're doing our daily huddles every morning at 8:15. There's a group of us that meets to look at, how are we doing with our PPE? Do we have enough? Do we need to start limiting things? And some of the decisions that we made today is, we are going to be limiting visitors, 1 visitor per patient. There will be some circumstances, end of life, power of attorney that, we may need to make adjustments to. We're limiting our vendors into our organization for essential vendors only. We're limiting access to the facility front entrance only, and then visitors can get in via their badge. So this is something, again, that's changing frequently, and again, we meet daily so that we can address those needs. From the med staff perspective, I'll go ahead and turn it over to Dr. Torres.
Thank you, Diane, and thank you to Mayor Mangarelli and to Leslie Horton for getting this multidisciplinary group together to address this unprecedented crisis that we may have in this community. I had the opportunity this morning to meet with the governor and other CMOs from Banner, Honor, Dignity, Phoenix Children's, Valleywise, and basically had a very good conversation of explaining to him what the challenges are for our communities in addressing these issues. From a YRMC perspective, I'm really thankful that we're going to develop a single source of information and communication with our Department of Health here, which will be the point person and organization to get the information out that we will collaborate with. Our medical staff is getting prepared to address these issues, from our emergency room to our inpatient services, as well as our ambulatory doctors. Ms. Horton said it quite succinctly: stay home, wash your hands, and follow the CDC guidelines. That's the best care we can advise at this point in time. As we move along through this crisis, we will be bringing more communication to you regarding testing and our organization with triaging for patients in the community. Thank you.
Thank you, John. Dr. Torres, Diane, thank you for being here today. I want to introduce Sherry Heine, who's the president of the Prescott Chamber of Commerce. We know that there is a financial economic impact here locally, so Sherry's going to come discuss that with us.
I want to thank you, Mayor, and all the leaders here and our community. This is a very interesting time for all of us. I'm happy to report that we are working on a federal and state and even local level to gather all the resources that we can for our business community. Earlier today, we assembled all the chambers and the economic development partners in Yavapai County, and we are uniting as one force for our business community. And we are going to be putting out information. It's probably being worked on and sent out to all the businesses as I speak right now. But we are united, and we are working with all the resources that we can to give support to our businesses during this time. So know that that's being worked on. And for all of our businesses out there, we're here, and we want to hear from you. And you are receiving that information from us. And you can go to prescott.org for that information. Secondly, I want to speak to the community as it relates to our business community. During this time, it's really important for all of us to remember that we can still do business. And business is just going to be looking a little bit differently than it has been in the past based on everything that we've been working on. So ways that you can help our business community right now is purchase gift cards. Buying gift cards will really help keep money in our businesses, and it will really help support them at this time. I also want to encourage you to shop online locally. We have a lot of our partners, our businesses, that have access to buying products and services online. So I want to encourage that. I also want to encourage you to use debit and credit cards versus cash at this time, because cash can carry germs, and we feel that the business card and the debit card, or those pieces, would be safer for everyone. And again, like everyone else has mentioned, please stay home if you're sick. There's a few other points I want to make, and one of them is we need to be patient with our businesses right now. Many of us, a lot of our employees are working at home because we're practicing social distancing, and so we're dealing with limited staff. So we need you to be patient with our businesses, and we also need you to be thankful for them and remember to be kind. These are times that are challenging all of us, and we're all trying to do our best here, and our businesses are in the same boat, dealing with everything that we've heard about today. So, again, please continue to support our businesses, and for our businesses, know that we're working for you as well. Thank you.
Thank you, Sherry. Thanks for your work. Propping up and supporting our business is very important. Everyone's presence here today showcases the strength of this community. I'd like to take a moment to assure everyone that there will be no interruption to essential city and county services during this pandemic. We will continue to conduct business while striving to protect and work with our dedicated staff members. The city has a disaster relief plan which addresses pandemics, and this afternoon I signed an emergency declaration which will help our community navigate through all of the intricacies that come with a situation like this. Additionally, similar to other local municipalities, the city is taking a number of measures to ensure the needs of our community and staff are met. Council meetings will be conducted virtually until further notice. All boards, commissions, and committee meetings are canceled until further notice. The Prescott Library will be offering curbside services beginning later this week. Trash removal services and the transfer station will remain open and operating as usual. City parks will remain open, and usage fees will be waived until further notice. Public Works staff will be available to place signage outside of all restaurants that decide to offer curbside pickup. We think this is a good alternative for our restaurants. Community development operations will continue as usual with both plan submissions and inspections, so you will not see an interruption in those services. In discussions with some of our local major retailers, I'm assured that supply chains will increase as the week continues. I encourage everyone to continue following state guidelines, and please remember that we are here, all of us are here to help you. It's important to remember that if we remain calm and help one another, it will be much easier to get through all of this. We will continue to keep the public informed as we move forward through these times with press conferences as needed and updates via social media. At this time, we'll take a few questions from the media. Cindy? Right, so the question is in regard to restaurants and bars staying open. In the Phoenix area, they have closed bars and restaurants down there. The governor this morning, maybe outside of the meeting you were in, he's been a busy guy, but the governor did talk about this on a conference call today. And there's also a social media post, I think I saw it on Instagram, from the Arizona Department of Health Services. And what they're suggesting is that they're recommending restaurants and bars close in Pima, Pinal, and Maricopa County. Those are areas where there's larger outbreaks. We have not experienced that yet up here in Yavapai County. In addition, they had some other recommendations on that post where you want to be 6 feet apart and all these kinds of things. I know that here locally, Cindy, most of the restaurants are reducing their seating inside. They're instituting more cleaning measures. They're using paper menus. and then they are also doing a lot more curbside pickup. So at this point, we're following the state on this, and they will remain open, but we would ask that those restaurant operators be very, very careful in terms of their practices, their hygiene, and reducing the number of people that they have inside. Other questions? Yeah, Lynn? Yeah, the question is regarding EMS services. Would Chief Light, you want to answer that?
Well, good afternoon. Dennis Light, Fire Chief, City of Prescott. We've been meeting fairly regularly. We actually put in some screening questions as early as 4 weeks ago into our 911 system in order to better screen our calls for the potential of flu-like symptoms. Those were modified today. And with that modification, we no longer ask about international travel because at this point it's kind of coming past. We have looked at our sustainability and resiliency from the fire department perspective, and we have a operational plan in place to enhance our staffing and add capacity to the system should the system demands drive it. We were also part of the meeting yesterday at YRMC. We continue to meet with our partner agency, primary partner agency, Central Arizona Fire Medical, and our private ambulance company, Lifeline Ambulance. I think we have a very unified approach, and I feel very comfortable that we are equipped, should things not go catastrophic, at least for a sustainable period of 45 days. Thank you.
Yeah, Cindy? Question regarding ventilators locally?
Yeah, great question. And you hear a lot on the state and national level about capacities. And Yavapai, within our system, our 2 hospitals, we have roughly 40 beds that today are equipped to manage ICU patients. Now, we have processes where we can go to different areas, and I'll give you an example. The GI lab, there's wonderful suites in there that we can turn in and deliver a higher level of care. So we have a lot of flexibility in the type of resources we have and how we employ those. Specific to your question on the ventilators, we roughly have 80, I believe is 82, thank you. I talked to my clinicians there. And those are available in the system. And we actually talked this morning, we're gonna trigger a request for some additional units. You can actually get a smaller unit that's more portable. And so we're going to be increasing that stockpile as well. But great question. Thank you.
Yeah, Lynn?
Are there any tests pending at this point?
Any tests pending at this point? Leslie, you want to answer that?
Yeah, thank you. I can answer to that. And there are tests pending, and currently, and starting yesterday, we have more providers offering testing, and that's where I really need people to go to their providers if they think they need a test and do some opt-out tests like flu, possibly strep, and others. But we do have a number of tests that have been run. They're being run through local labs. If they come back with positive results, we can get a confirmation from the state lab now. So it's a quicker turnaround on confirmations. Might take a couple days. It may take, I've heard, 3 to 5 at the most, depending on the backlog. But right now we do have pending tests. We await the results, and like I said, if they get posted or if they come back confirmed positive, you will know right away through our Yavapai County website.
Can you tell us how many tests?
I cannot tell you that at this point, and it will. There's going to be a backlog on information with that for me for the next probably week or so as we catch up to this new era of regular testing amongst other providers. I do know that there's some scarcity among tests still, and we really truly want to allow our most high-risk individuals to test first, as well as those who come into contact with them most, such as first responders, medical personnel, and others who would possibly have the most aptitude to spread to our most at-risk people. Thank you.
Other questions? All right. I want to thank everyone for attending today. That's all we have for today. I want to stress again and just reassure the public that we're going to get through this okay. We have a great team here. We have great partnerships. We're collaborating. We're working very, very hard on this around the clock, and everybody's going to be okay. Remain calm through this whole endeavor. I want to wish everyone a happy St. Patrick's Day, by the way. Be safe, and God bless you all. Thank you.